live with hip pain, you know it can be drastically affecting your life, and if surgery might be an option for you, you need to know what you should consider leading up to that decision. Dr. Bryan Kamps is an orthopedic surgeon at Spectrum Health Medical Group, and he's here to talk about arthritis hip pain and some of the solutions that are out there. Doctor, thank you so much for joining us.
Thanks for having me, Jordan.
It's very interesting that we're doing this story together because I just went in 2 days ago to talk about my hip pain. This is something that affects all ages.
A lot of people,
Yeah, so tell me, what are you seeing right now?
I tend to see people who are a little bit older, and so they have what we call degenerative arthritis. That's the main type of arthritis that we see. And when those patients come to see me, then we talk about, well, what are the treatment options for that kind of arthritis? And so we'll talk about things like, well, what kind of activities can you participate in? What kind of medications can you take? Are there certain treatments, say injections, that we can use, or physical therapy? And then we also talk about whether you might be a surgical candidate for that hip arthritis.
You know, a lot of people, because of the cold winter months, they're feeling some aches and pains. What are some of the symptoms that people should look out for and know that this is not just the cold weather, there's something more there?
If this tends to be pain that persists in spite of, say, rest, if it persists though you take a simple medication like Tylenol or ibuprofen, those are indications that maybe you should talk to your physician about that.
Okay, let's talk about hip replacement, because this is something that a lot of people think about. They don't know if this is the right option for them.
So if we kind of go back to those treatment options first, when I talk to patients about their arthritis hip pain, I will talk to them about, well, these are the things that we can do for your hip pain. We can treat you with medications. We can send you to a physical therapist. We might talk about an injection in that hip joint. And then if you have pain in spite of that, then we might talk about, well, are you a candidate for hip surgery? We get x-rays and we look to see how advanced is that arthritis. And if you have advanced arthritis, the non-surgical treatment options aren't working, that's when we talk about doing surgery for that hip pain.
Okay, you brought something in with you. Can you tell me a little bit about this? And then we're also seeing a graphic right here.
On the graphic, you can see on the top left there is a hip replacement which is kind of pulled apart. And so on the bottom part you see a shiny ball. That replaces the ball of the hip joint or the femoral head. In between there's a little plastic liner, it's called a cup liner there, and that fits inside of the acetabular cup or the socket. And so that's a metal cup that fits into the pelvis bone. When we put all those together, you have a metal and plastic joint, or metal and plastic bearings within the hip joint. So then over on the right side, a little bit lower down, there's an x-ray of a hip replacement. Those white things you see in the x-ray, those are metallic pieces. And then in the top right is a computer-generated model of what a plan for a hip replacement might look like.
Okay. This is all really valuable information. You brought in a demonstration. Can you explain to us what this is and what this actually does for your hip?
What I have here is a model of a hip replacement, and this is an acrylic material, so bone obviously isn't clear like this, but this is made out of acrylic so that you can see how the pieces fit inside the bone. So in my right hand here I have a femur. And this has, I don't know if you can see this real well, but there's a stem that goes down inside the bone here, and that holds this femoral head in place. And this is after we've removed the femoral head.
Okay.
Then on the pelvis side, we have the metallic socket that fits inside the pelvis bone, and then inside that socket you can see a plastic or polyethylene liner.
So, and that's where a lot of people get the inflammation that's causing so much pain.
It will be in between that femoral head and the socket. That's where you get that inflammation. And so when we do the hip replacement, we're replacing those worn out hip parts with metal and plastic bearings, basically.
Okay, talk to us about robotic assistance.
Robotic assistance is something that we have developed to address a few of the difficult issues we have with hip replacement surgery. One of the difficulties is that there's a certain low rate of these joints actually dislocating after you put them in. And if you can look at this socket here and imagine that maybe it's not quite lined up the way it should be, then this might pop out of the joint a little bit more easily.
Okay.
And so what robotic assistance does is it helps us to make sure that we get that cup aligned in that pelvis just right so that that lowers the chance that you might dislocate the joint. The other thing that we can address is to make sure the leg isn't too long when we put that together. So those are two things that that robotic assistance really helps with.
Yeah, every patient is so individualized, and you can help and really get to the root of the pain instead of masking it. How can people reach out to you and find more help?
We have some information here about contacts, and I think those are really a good way. I think also that when you talk to your regular doctor, that physician is a good resource to help you with deciding whether you should see an orthopedic surgeon or not.
Well, thank you so much, Doctor. Great information. We all want to be active this summer, and you can help people do that.
Well, thanks for having me, Jordan.
Thank you.
Are you West?